Well, again, this station is very common. It is repeated. That's why, as you know, it is a station in which you are going to talk with a student nurse. You are not going to talk to a consultant anymore. Pay attention to the non-pharmacological ways of the treatment, because this patient needs occupational therapist. He needs the support of social services to make sure that his duration of treatment is not going to affect his work. He might need the support of substance, alcohol, substance misuse services, or smoking cessation clinic. He needs some sort of motivation to help him to be incorporated in the rehabilitation program, and also the involvement of the physiotherapist, because not every activity is going to be, not every physical activity is going to be suitable for him with this heart problem. Okay.
Okay.
Don't forget the formulation, and don't forget that you are going to liaise with the doctor, with the cardiologist, because your medication, which will be the SSRI, can affect the coagulation profile of the patient. It is very important. Not every candidate say this, so they must adjust the medications accordingly. Okay. Okay, and the CBT also, of course. Okay, let's start.
So I'm gonna talk to the student nurse.
Yeah. Ready?
Okay.
1, 2, 3, go.
Hello, I'm Dr. Nashad, one of the psychiatrists from Mental Health Unit.
Hello, doctor.
How may I address you?
You can call me Robin.
Okay, so I'm here to talk about Mr. Brown, one of the inpatient who was assessed here.
I'm very confused about his condition. He looks so sad, and it is important for him to be involved in the rehabilitation program, but he is not involved. And even worse, doctor, the nursing staff said that he goes out and smokes, and definitely this is not good for his health. I would like to know more about his condition.
Okay, and you mentioned that his mood is depressed. So is he posing any risk to himself?
Well, I don't know, doctor. I just read the notes, and I had a simple chat with him, and I decided to know more about his condition from you.
Okay. So I assessed that patient, and yeah, he was having low mood, and he was having decreased interest in his life, and he was so less motivated that he did not want to continue with his cardiac rehabilitation program. And it was on the background that he was not able to do quite well in his work. So this was the reason of his depression as well. But he was not having any risk to himself or others. So that was my understanding of his condition.
Okay,
Currently,
doctor, so what is why he is not that involved, and why he looks so sad?
So according to my diagnosis, he is having post-myocardial infarction depression. It is very common condition that occurs after in patients with myocardial infarctions.
Well, I've never heard about this before.
Do you want to tell me more about it?
Well, I don't know anything about it. You are the one who should. If you want to say anything.
So it's a condition, as I mentioned, that it's like a general depression, normal depression that occurs in patient who had myocardial infarction, and it could be, or it can occur due to multiple conditions, multiple factors, and the person is usually have low mood, decreased interest. He is not interested in his daily activities, and he have issues with sleep. And it is common, like he has issues with his sleep and appetite, and it is common after heart attack.
Well, doctor, I'm wondering, so are you sure that this is the only diagnosis for him? If there's any other possible
Yeah, there could be another, yeah, exactly, you're right. As he had heart attack, so it could be adjustment disorder as well. This is one of the possibility.
Yes. So you said that the myocardial infarction caused depression, but this man has been depressed before the myocardial infarction. I'm wondering, does myocardial infarction cause depression?
Well, there are different theories. They both are correlated actually. So it could be certain factors related to thinking process that lead to the old depression come in, and certain factors related to the chemical imbalance that could cause the depression come in new patient. So it's like both can cause each other. Hope I'm making sense.
Okay, doctor. So, well, how can we help him, doctor?
Yeah. Regarding the management, first of all, as this patient is posing no risk to himself, so he will be treated as an outpatient. Then I want to examine the patient, take detailed history from him, and do further test as well. So, to see him that he's ready to take the medication or not. I will take basic investigations like full blood count, LFTs, RFTs, etc. If he is ready for the medication, I will, put him on the drug as advised by the research called SATHERT and NICE guidelines, which we use in here in England. And after he started on it, I would also like to involve him with the talking therapy. Uh, are you with me so far?
No, I lost you. You gave me a big chunk of information. So you said
Okay,
that he is
okay.
going to be treated at home. So,
Yeah.
well, I'm wondering if he is at home, will he be motivated to come to the hospital frequently as he should?
Well, for this purpose, we will, keep in contact with in him in multidisciplinary team, and our community health team will, uh, help him in involved in getting in touch with with us, and he will be getting his medication and the other form of therapies.
Well, I see, no, I see. So, well, you said that he's going to take this the particular medication. You said it is an antidepressant. Well, if
Yes.
there is any particular medication which he should not take. 1 minute remaining.
Yeah. The particular medications are first tricyclic antidepressants, and the other one is venlafaxine. Tricyclic antidepressant can actually, mess with the heart rhythm, and venlafaxine can increase BP, blood pressure. So we should not give them to this patient.
So anything else can be helpful for him, though.
Yes. So I wanted to talk to you about, the cognitive behavioral therapy, the talking therapy, which can help a lot in this kind of situation. I You are with me so far?
Yes.
I also want to talk about the multidisciplinary team that involve the occupational therapist, and we would like to keep in contact with the cardiologist.
Who is that now?
Hi. Thank you so much. How do you feel about what you did? Very clever, by the way. So no problem. There is no place here for anyone who can feel embarrassed from anything. Do whatever you want here, but as long as
Okay.
you're not going to do the mistakes in the exam. So how do you feel about what you did?
Yeah, I think maybe I lost the structure or something, and should have talked about the other majors more. And yeah, I was lecturing and
Yeah,
too much chunks.
yeah, too much chance. So, and when you please understand that again, please understand the setting. This student doesn't know anything. So you don't ask me, does
Uh,
he pose risk about it for himself? Exactly the same situation like the previous station. Understand the setting. Sometimes the role player does not have any information to ask you. So does he pose any risk for, and in the previous station, does he have any medical problem? The man is in her ward and she's asking the family member. So this is not the best question definitely be asked. So the first, now, but two, post MI, please, when you explain it, try to simplify it and chunk and check. Well, and then you ask me, do you want, and you ask me if I want to say more about that. I didn't get this question. The differential diagnosis here is the adjustment disorder with mood symptoms, and this can be another attack of depression. However, because of the past history and the temporal relation between the onset and the myocardial infarction, we highly emphasize that this is a post-MI depression. Now, as I said, doctor, there is a close correlation between post-MI and depression, and I think I sent for you 5 pathophysiological ways by which depression causes. Please, you did not mention any one of them.
Yeah, I actually was looking for it in the group and I couldn't find it.
So why didn't you prepare it from the beginning? Why didn't you prepare it? Okay, so I will try to resend it again.
Okay.
It is very important and would give impression about you that you are very professional, because not everyone knows this particular piece of information, that depression causes strokes and also causes myocardial infarction. So there is a close correlation between them. I will resend these 4 mechanisms. Where did they go? Yeah. I will send them on the Telegram group. Have a look at them. Okay, if you did search properly, you would have found them. It is in the WhatsApp group. Okay, let us see what is the next feedback. Please formulate, Dr. Laila.
So this patient is having a post-myocardial infarction depression on the background of him not doing very well not doing very well at work, and he's posing no risk to himself or anyone else.
He is not posing any risk to himself or anyone else. So there is no risk then?
Yeah.
Are you sure? Please read the chat section. Read the chat section. This man is going to die. How come there is no risk? This man is going to die.
Okay. So there is risk involved because he's not.
This man has high fatalities. The depression, the risk of mortality with my post-MI is exactly like the risk of mortality of someone who is having another myocardial infarction on top of the previous myocardial infarction. Or some of your colleagues saying it is 4 or 5 times. So this man is on high risk. And this piece of information or misinformation, I think, is enough to end the station for you. Please never give a false information, particularly on the risk. You say that this man does not have any risk. How come? This man is going to die, doctor. This man, your patient will die. Okay. When you send him back home, he will die there, and you will.
So we should say that there is a high risk of
mortality. Yes, mortality.
Okay.
Okay.
Thank you.
Okay, so outpatient definitely is not the best thing. Please chunk and check. And unfortunately, we do not talk about any of the non-pharmacological ways of helping this patient, which is very important.
Yeah.
Okay. Okay, so let's see according to our mark sheet and to our slides. Okay, let's be objective as much as possible to make sure that we are not critical opponent. So in this station, there is no place to gather the information. However, you can give him yourself anyway. You can do a summary or you can do a formulation. And this is the easy part of the station because this will save you time. This man does not know anything. So you can just give him a start with the formulation. Please don't be so concrete while you are having or approaching this plan, okay? Because there is no place to gather the information. You can explain for him the diagnosis and then do a formulation, each one as you like, but never keep asking him questions while he's a student nurse who doesn't know anything. Okay, this means that you don't understand the setting. So explain the diagnosis and don't please choose simple words and pay attention that there is a correlation, as you said, between both of them and why the depression causes myocardial infarction. The reasons are in the group. Formulation, you did formulate, and then your management plan. The first thing which you should do that you are going to talk to this man, and most of the candidates forget this. You want to talk with him to understand more about why he is not motivated. You can apply some motivation interviewing skills to help him to be motivated to be incorporated in the rehabilitation program. One, to assess his mental state and also do thorough risk assessment. Where he's going to be treated, he's going to be treated in the hospital because of the high risk, because he is still in the hospital. Do not discharge him. You are going to have another look on the investigations because you are going to start him on medications, particularly kidney functions, liver function, etc. Multidisciplinary team, very important to say that I'm going to raise with the cardiologist because our medications can affect the clotting profile. Your psychological approach will be the medications, and CBT is very important, the non-pharmacological, as I said, the social services, occupation services, the dietitian, the physiotherapist, the alcohol and substance misuse team. Maybe he needs some sort of support from them. So as you can see, there are many things to talk about in the non-pharmacological area. Okay.
Okay.
Okay, so let's see the mark sheet. Okay, so you did formulate. Okay, we will see. Okay, we'll consider this formula. You did not recognize significance of findings of results because this man is having depression. He has myocardial infarction, and you said that there is no risk, and he's going to go home. Your management plan is not adequate. He only talked about the medications and CBT, which is not enough. You said that you are going to talk with the patient, so this is going to be scored for you. Risk management plan definitely is not going to be scored for you. You said that there is no risk and you go home. Psychological, you did not mention the social, but you mentioned the psychological. So this point might or not be scored for you according to the assessment of the exam. Your communication skills is okay. So everything in the communication skills okay. However, in the management points, I think you lost considerable amount of points. Thank you so much, Dr. Laila. Don't get frustrated, okay? Anyone wants to mess up here, no problem. And I will happy if he messes up because this opens the discussions about the common mistakes which the candidates do. So make sure that all the candidates are doing the same mistakes which you are doing, all of them. So it's no problem. Thank you so much.
Dr. Hassan.
Okay, so who would like to go next?
Dr. Hassan,
Can I do?
Yeah, I think we have a list, doctors, in order just to make sure that we are organized. So we have a list. There are many messages in the chat section, but I think Dr. Muhammad Sami is the one who should do the station now.
No,
and
sir,
then Dr. Santosh.
Dr. Arif was due to do the second station.
Excuse me?
Yeah, I know, Dr. Arif, you are the second station, but I am the first station. And I do know if you working according to the queue or just working. I don't know.
Okay, just wait, please. We don't want any disputes. We can just, this
okay,
is the turn.
You can
the turn of Dr. No problem, doctors. We are okay. Please, is this a station of Dr. Muhammad Sami? Okay. And then we will see who will do next. So what is your station, doctor?
Refeeding syndrome.
Yes, refeeding syndrome. This is a very nice station. Again, doctor, you understand the mechanism of refeeding syndrome? What happens?
Yeah.
Yeah, because there is a rapid shift from the fat as a source of energy to carbohydrates, and this consumes a lot of electrolytes, particularly phosphates, and this causes metabolic disturbance, and the patient's medical condition worsens. Okay.
Okay.
And this causes confusion, causes every later on all the but you try to make it simple, and it is considered to be a medical emergency. The backbone is to correct the electrolytes and give a lot of thiamine. The patient is going to stay in hospital until her condition is stable, and then she can be treated at home. And then there must be some sort of family education, because her mother tried to help her in the wrong way, and this should not happen again. So there must be some sort of family education. Okay,
Oh, yeah. Okay.
let's start. 1, 2, 3. Let's say that my name is the student, the nurse who's going to discuss her condition with you. Her name is Rachel, and the patient's name is Amelia. Okay. Don't forget the names, okay? Don't mess up with names. 1, 2, 3, go.
Hello, Mrs. Rochelle. I'm Dr. Simon of Psychiatrist working here.
Hello.
How are you? I understand that you have some concerns regarding to Emilia.
Yes, doctor. You know, Emilia was doing fine. She is diagnosed with anorexia nervosa. And for the first 3 weeks, she was doing fine. She was doing around between 2 and 2.5 kilos per week. And we felt that she was improving, but in the last few days, she has deteriorated rapidly, doctor. She is confused, and her hands are swollen as well as her feet. And I want to know what's going on with her.
Oh, I'm sorry to hear that. I understand, yeah, from the notes that her mother gives her a lot of nourishment. So she gained about 3 kilos per week, which is too much. So this, what happened is a condition called refeeding syndrome. Have you heard about it before?
No, what is refeeding syndrome?
Refeeding syndrome, it is a disorder where body fluids and salts are imbalanced due to rapid shifting from from fat to carbohydrate. You know, in starvation state, the body will depend on fat, but when we shift rapidly and in a lot quantity of carbohydrate, the body in this situation will shift to carbohydrate, and insulin will increase. This will lead to electrolyte and fluid imbalance.
I see.
Following?
Yeah. So is it a serious condition, though?
Yeah, unfortunately, it is a serious condition because it will lead to decrease phosphate and also decrease potassium, which is involved in muscle. This lead to hypokalemia and hypophosphatemia, which affect the way of swallowing, and also will lead to edema, even may cause seizures and coma, and unfortunately in the end will lead to death.
I see, doctor. So, well, I'm wondering, doctor, how we can help.
Okay, thank you for asking this important question. In this situation, we will treat this patient in inpatient in a medical unit because it is an emergency condition. So we will work as a holistic approach. We will first do blood investigations and tracing her heart by doing ECG. After that, we will correct the abnormalities of the of body salts. In this situation, we will do as a holistic approach. We will, as a psychiatric team, as a dietitian team, we will liaise with the dietitian, also with the medical team, and at the end, we will need psychology team. Does it make sense to you?
Yes, yes, doctor. So, well, do you think that this can be, well, once she goes home, how can we prevent this from happening again?
Okay, we will do gradual nourishment, gradual regain the abnormality, not sudden and in a lot quantities. That what happened. We will our goal will be about 0.5 of kg per week to 1 kg, sorry, 1 kg per week. This will be our goal, and we will give here thiamine and multivitamins, especially vitamin B complex. Also, we will correct any abnormalities for electrolyte, especially phosphate and potassium. Does it make sense to you?
Yes, yes, doctor. So, well, do you feel that she might get better, doctor?
Yeah, in these situations, we find many people who get improved when we do this holistic approach, and we will arrange with psychology department for doing family family education, family therapy to educate the family how to deal with the condition, and also we will monitoring Emilia till her condition be improved.
Okay.
Do you want to ask about anything else?
No, no, thank you.
Okay, thank you for discussion this important condition with me, and I am happy to answer your concerns at any time.
Okay.
Thank you.
Thank you so much. How do you feel about what you did?
I don't know.
You still had more than 1 minute.
1 minute.
How do you feel
Yeah.
about what you did?
1 minute, I think there is a problem. I don't know where, when.
Okay, so first of all, pay attention that when you try to explain, make your explanation fluent, it is shift from fat as a source of rapid shift from fat as a source of energy to carbohydrates, not fat, because you said that the rapid shift from fat to carbohydrates. So I didn't get what do you mean by fat from carbohydrates as a source of energy. Okay. I felt that you know the explanation, but you were struggling in saying it. Please chunk and check because in a big part you're lecturing. Okay. 1 minute, please.
Formulate the
you did not formulate. I don't know why you didn't mention the dietitian as soon as possible when I asked you how to prevent this. The best answer is to do family education, as I told you, because her mother was the reason for behind this. So the mother must be educated about the needs of the patient who has anorexia and how to help her in the best way. This is how you prevent this. And also her diet should be under the supervision of the dietitian. When I ask you how is she going to get better, I expected from you to discuss with me the prognostic factors for the refeeding syndrome and for the anorexia nervosa. You did not mention any of them. This is how. Okay, so let's see the feedback of our colleagues. Well done. Please avoid medical terms. Okay, maybe. But by the way, this is a nurse, so this might not be considered very much a jargon. Very empathetic, chunk and check. Okay, well, You have big fans here. Formulate, yes, you have big fans here, doctor. So let's see according to the worksheet, to our slides. So again, doctor, in order to make sure that you are not going to miss anything, try to fix to this plan, which we are repeatedly discussing. And later on, you can manipulate it as much as you can. But as you can see, if you have stuck to this management plan, you would have not missed these things which you are wondering at the end of the station, what exactly did you miss? So you should have, in the beginning, you should, whenever you are talking with a nurse, as I always say, do a handover. They expect from you to take a handover. So this is a nurse who has been taking care of this girl medically. So she has some information. Make sure that you get this information. And not only if you are talking with a nurse, you should cover the biopsychosocial and risk points related to the patient, but you want to know what are the management steps taken so far. This is how you do the handover. You ask about the biopsychosocial information and the level of risk, and also what are the management steps taken so far. Okay, do you understand, doctor? So after discussing with her the possibility of the refeeding syndrome, ask her about her physical condition, any investigations done so far. Does she have any medical, any psychological problems now other than the anorexia? What is the level of support does she get, and whether her mother understands the needs of a patient who has anorexia? Any concerns about her safety other than the medical problem? And then ask her what are the steps taken so far to take care of this girl. Okay, this is how this is the big chunk which you should have done, and that's why you had a big, not less than 1 minute at the end of the station, because in this time you should have covered all this. Okay, doctor? So now, number 2, you did not formulate. Having said this, please formulate.
Okay, refeeding syndrome, anorexia nervosa, low phosphate level, all investigation normal except low phosphate level.
I want you just to say your formulation in the form of a dialogue. So I would like to highlight the most important points in Amelia's condition, which will help us to focus on her management, which we will focus on in her management plan. And you start by the main psychological problem. She has anorexia nervosa and refeeding syndrome, which carries high risk if it is not managed properly. All this that we need to know more about the impact of this syndrome on her physical condition. That's why you're going to do investigations. Okay, we need to assess her psychological condition. Also, we need to know more about her social circumstances and the level of information which her family knows about the needs of a patient who has anorexia. You can formulate by many ways, but make sure that you formulate. You don't need to formulate exactly like me, but make sure that you formulate, because there is a particular point. Actually, it is the very first point of the formulation. What is the current situation, the level of risk, and you should also talk about the background, the biopsychosocial areas of the patients. Okay? And then when you set the management plan, as you always do, there is a point about for those doctors who are keen to talk with their patients and explain for them their disorder. Talk with Amelia, tell her what is the problem. The patient is not deaf or mute. She is sane, so you should talk with her, explain for her problem, do physical assessment, do thorough risk assessment, explain for her management plan. Okay, where the patient is going to be treated, you said. Investigations, you talked about the investigation of the multidisciplinary team. Mainly, there will be a physician who's going to follow her up, and you are going to, because she is in the medical side, when she is fit, And he's going to give her fluids and thiamine when her physical condition is fit and the electrolyte disturbance is controlled. She's going to be discharged, and she will be followed up by a dietitian, also by the psychotherapist and the multidisciplinary team, etc. Now, when I ask you about, is she going to get better? You have two problems here. This lady has refeeding syndrome, and she has anorexia nervosa. Regarding the refeeding syndrome, it is a physical condition. So the early treatment and the more cooperative the patient is, and also the absence of any physical condition, all this favors the good outcome. Regarding the anorexia nervosa, it is a psychiatric disorder. So particularly, you can use this schedule, but it will be better if you talked about the particular prognostic factors of anorexia, which is in this slide. You will not find it anywhere else. You have the age of onset, you have the childhood adversities, the duration. Mention 3 or 4 of them, but make sure that you mention the social factors among them. The absence of amenorrhea, the number of episodes, the age of onset, the childhood. Mention any 3 of them at least, but make sure that the social factors will be one of them. Okay?
Yeah.
Thank you so much. Let's see the mark sheet. Let's see the mark sheet. Okay, so you did not formulate. Unfortunately, this point is not going to be scored for you. You recognize the significance of findings. The result, the management plan, well, I don't know. You talked about the admission, you talked about the thiamine, you talked about the fluids and dietitian. So yeah, then okay. But point number 4 is not going to, you did not talk with your patient. The risk management, you said that the patient is going to be admitted, is going to be scored for you. The psychological and social interventions, I felt that you should have said clearly that this lady, this girl needs her family to be educated about how to help a patient, because the story goes that her mother is the one behind all this problem. So please pay attention to the social intervention. Well, it was a bit formalic because I felt that you were lecturing. Other than this, everything was good. Everything was style and a bit disorganized. But everything was okay. Thank you so much, doctor. It was good. Okay, you're clever.
Yeah, thank
So
you.
who would like to go next?
Who next?
Well,
Hello,
Dr.
audible.
Asad is giving a very good feedback. Very, very good. Very good feedback. Please read his feedback in the chat section. His experience in the cast and very clever psychiatrist. Okay, so Dr. Santosh?
Yeah,
Okay, how are you, doctor? So what is your
I'm
station?
good. Thank you. Puerperal psychosis.
Yes, Puerperal psychosis.
Yeah.
Okay, do you have any questions regarding this particular station?
No, that's fine. I can start.
Okay, we'll start now. 1, 2, 3, 4.
Hello, Mrs. Bakers. I'm Dr. Kumar, one of the psychiatrists from mental health team. How are you doing today?
Well, I'm fine, doctor, but I'm worried about my wife. She's not fine, and I don't know what to do.
Okay, I understand that your wife has been pregnant for last 36 weeks and she had 2 episodes of puerperal psychosis in past. She was doing fine with quetiapine and lithium, 2 medications, but she has not been taking it for last 1 year as she has been doing well. I'm here to address your concerns regarding that. So before we go, will you like to ask any concerns if you have?
Yes, doctor. I'm worried that
Yeah.
this lady, my wife, is going to have another attack because she had a horrible attack before.
Okay. Yeah, I can see that you're all quite concerned. But please don't worry. We, the multidisciplinary team from this hospital, will try to help you out in the best possible manner. But before going, I need to understand few things about your wife. Will that be okay with you?
Okay.
Okay. So how her mood is?
No, she's doing fine. She's doing very fine.
And is she sleeping well?
Yes.
Eating okay?
Yes, yes, yes.
Okay. And do you find that she's having any strange experiences like hearing voices?
No, no,
Right. And is she doing well in her physical health?
no. Everything is well, but we know that every time she has a
Yeah.
pregnancy, she goes to the hospital.
Right, right, right. That must be concerning actually. So with all this going on, does she ever feel like harming herself?
No, no, no.
And is she on any of the medications?
No, she stopped all the medications according to the recommendation of the GP.
Right. And by any chance is she using alcohol to cope
No, no, no,
or any street drugs?
no, no.
Right. I can understand that you're quite worried about her. You're there to take care of her. Apart from you, is there anyone else at home to take care of her?
Yes, her mother comes frequently to take, as well as her sister.
Right. That's good to know. So just to recap things, your wife has been suffering from, your wife is pregnant for 36 weeks, and she had two previous episodes of postpartum psychosis, that is puerperal psychosis, and she carries currently a high risk of having this episode again, and you are worried about that, but the reassuring part is that she has good social support in form of you and your mother-in-law who is there to help.
Well,
So,
doctor, I'm wondering, doctor, what is the chance for her to have another attack of this purple psychosis?
yeah, and that's a genuine concern. Actually, there are, to be precise, there are nearly 30 to 80% chances that this might repeat, and more so since she already had two previous episodes. So there are nearly more than 50%, more than half chances, I would say, that she will have another episode. Yeah.
Okay, doctor. So how can we help her then?
Yeah, so like I said you earlier, we'll take a holistic approach in managing her through tablets, talking therapy, and social support that will be extending to you through the perinatal team that we have at this hospital. And I hope she must be registered with the NHS. Her pregnancy must be registered with the NHS. Is this the fact?
You did what? You are going to do what at the end? I didn't get what you said.
Is she following up with the NHS for her regular checkups with
Yes, yes,
regarding her
yes.
pregnancy?
She's following with the doctor with the
Okay,
obstetrician.
okay. So I hope she must be undergoing routine investigations like her blood counts, her thyroid function tests, kidney function tests, liver function tests, and some of the scans which the obstetrician might have advised her to, right?
Yeah. Okay.
So we will
So
review all of them, and then since she's having very high risk of having another episode, will advise that she be put on a form of medication, an antipsychotic medication. So, what's your view about that?
well, she has been taking some medications before, which help them, but the GP advised us to stop them.
Yeah, since she was doing well, it has been advised by
Yeah,
GP
yeah,
to
yeah. She
stop it.
was doing so
Yeah,
well on lithium quetiapine.
yeah, yeah. So, but we'll not advise her to start on lithium because there will be a lot of monitoring involved, and lithium needs to be kept in a certain range, therapeutic range. We cannot go above that, and we cannot go below that. If we go above that, it will be toxic to the mother and the child, and if we go below that, it will not be therapeutic. So it will not be advisable at this point of time. And above all, it gets secreted into the breast milk, so it will not be a good drug at this point of time, in my opinion. What do you think about that?
Well, but she has been improved on lithium and quetiapine, and
Yeah,
when she relapses, she is horrible, doctor. She used to be admitted not less than 1 month in the hospital.
yeah, I can understand your concerns. So we can start her on quetiapine if you wish, but we'll like to take the wishes of your wife in consideration also for that.
Okay, doctor.
Yeah. And I advise that it can, for now, although since she is 36 weeks pregnant and she's not having any
One
symptoms,
minute remaining.
she can stay at home. But it will be better if she has a planned pregnancy, and we'll like to admit her in mother and child unit at the time of delivery.
I see, doctor. I see.
Yeah.
Well, what type of support she can get other than this?
Yeah. So once she gets well, we can put you in touch with the crisis team and also the health visitor who can help you at your home.
Okay, okay, no. So,
Right.
okay.
So do you have any other concerns for me to answer?
No, there can be a breastfeeding on the medications which you are going to give?
Yeah, she can breastfeed, but we have to take care of the timings, and we should be giving the medications are around timings, which does not affect the breastfeeding, does not affect the child, and it does not make the child more sedated. So we'll be advising her in that regard.
Okay. So I'm wondering, doctor, will be there any possibility that these medications are going to affect the baby?
Yes, since it is late in pregnancy, it cannot affect, and there are very less chances that it will affect the baby as far as birth defects are concerned, but it can make the baby sedated. Yeah.
Okay,
Once
thank
he
you
is
so much.
breastfeeding.
Time.
Right.
Thank you so
Thank
much.
you.
How do you feel about what we did, doctor?
Yeah, I was a bit too fast while speaking. I found
Yes,
that
yes.
at one point of time, you found it difficult to get me.
Yeah. So I hope that all the candidates can give us their feedback. So the first thing, please show empathy. When I said that I'm worried about her, show empathy, understand how much and we are going to do our best in order to help you. This exam, doctors, is about your communication skills. Please pay attention to this. Once the role player opens his mouth, most probably he will elaborate some sort of feelings. Pay attention to this and show empathy. Well, it's very good that you ask about did you ask about the pregnancy and who is supporting her? I think you did. Well, I don't know why did you say we cannot advise to take lithium. So this lady have very risky past history, and the only combination of medications which helped her was the lithium Puerperal. And she is already late in the pregnancy, so this combination will not affect the development of the baby. So I don't think that this is the best treatment plan from my perspective. Maybe the consultant will have another opinion, but from my perspective and what is written in the notes, that she is going to be reinstated in her, and this combination helped her, and she's going to be followed up, bearing in mind that she is in late in pregnancy, and lithium is not going to be she is not going to nurse the child as long as she's taking lithium. Why is that? Because the risk on her on the baby is high if she did not take this combination. Though lithium is in the combination, and it requires a lot of follow-up, as you said. And I hope that I get a feedback from the colleagues in the chat section, because there is some sort of dispute. Dr. Santos say that no, she should not take lithium, but as far as I know, she should take lithium. Okay, I hope that you mentioned the perinatal team, doctor.
Yeah,
Perinatal team, mention the team if there is any mention.
Yeah, perinatal team consisting of the obstetrician. Oh, maybe I missed it.
Okay.
I don't know. Others might say. I think
Okay.
I've said.
Okay, so very well done. You have a lot of fans here. It was good. It was good. The only thing that which the issue of lithium, and in the beginning I felt that you're very focused on what you are saying and you're not paying attention to what I feel. Just show empathy. That's it. Let us see the slides. Okay. So you gathered the relevant information, her past history, her current mental state, the social support she's getting, and any concerns about her safety and the safety of the kids. I think you did so. You did, doctor, didn't you?
Yeah, I did.
Yeah. So this is where you started. It was very good. And then you explained that she has postpartum history, postpartum psychosis, and now she is having high risk of having another attack, bearing in mind her past history, and the risk is up to 80%. And that's why you need to intervene immediately. Formulation, please formulate, doctor, if you don't mind.
Yeah. Mr. Brown, just to recap things, your wife is currently pregnant by 36 weeks, and she had 2 previous episodes of postpartum psychosis, and
Yes.
since she has very high risk of developing it again, and
Very
the
good.
reassuring fact is that she has support from you and also your mother-in-law.
Okay, very good, very good. All of the background that she doesn't have any underlying medical problems. There is a past history of psychiatric disorder, and she has good support. Okay, that's just the background is important to make your formulation as much as possible good, to make sure that he's going to score for you the formulation. Okay, so now the setting the management plan. I hope that you said that I'm going to talk with this lady. Always you miss. Well, I thank you for this mistake, because doctors, when I say I'm going to talk with the patient myself, this is not just to show that I'm a cool doctor. There is a point in the mark sheet for the doctors who pay attention to the patient's health view. So you must talk with the patient, not for the sake to impress the consultant or to show that you are some fancy doctor, no, because there is a mark sheet which has a point for those doctors who will talk with the patient, okay? Where the patient is going to be treated, basically, is going to be treated at home. But when she is about to give delivery, she's going to be admitted, and then she's going to stay in the mother and baby unit, okay? And when she goes back home, she's going to be followed by the multidisciplinary team. You're going to do all the investigations required to make sure that she's going to be fit to take the medications, and also to adjust the lithium level, because according to the delivery and the time and the amount of fluids, you must say this. You don't need to say exactly what would happen, but you can say that because of the delivery and the amount of fluids, which we will need to adjust the lithium level more frequently. A multidisciplinary here, you include the perinatal team, the obstetrician, the psychiatric nurse, and everything else is good. Okay, that's what you are going to do. You are going to reinstate the lithium and butyl. Okay, mark sheet. Let's see, have a look at the mark sheet. Okay, so you did formulate, I think. You did formulate. Okay, so the significance of findings and results, you paid attention that this lady has a past history of admissions and risky postpartum psychosis. Your management plan, well, here a management plan, there is a big question mark. For me, I feel that you should have added lithium. I don't know, maybe you are a professional consultant, and I don't know actually what the consultant who will mark you will consider your answer as right or wrong, actually. But as far as I know, and what is written in the notes, that she has been improved on this particular combination, should take this combination. So I will leave this point. This might be or might not be scored for you. Unfortunately, you did not talk with your patient, so point number 4 is not going to be scored for you. Risk management plan, you did pay attention to this. Psychological and social interventions, you said that there will be a team and there will be a nurse who will follow her up. It was organized, but sometimes I felt that you're lecturing. And why is that? Because when I say that I'm worried about her, I did not feel that you are very empathetic. So this gave me an impression that you are formal. Other than this, everything was good. Thank you so much.
Thank you.
Very clever, Dr. Santosh. Pay attention to the feedback. Don't get frustrated. And again, I'm not saying that someone will pass or fail, just helping everyone to understand how the mark sheet works, and also to give you my experience. Thank you so much.
Thank you very much.
Thank you, doctor. So who would like to go next?
Doctor, shall I go next? Dr. Arif.
I think Dr. Arif, I think this is the turn of Dr. Arif. Yeah. Okay. Okay, so
Video
what is
cannot
your
be switched on.
Only audio is recommended.
Actually, the video cannot be switched on. Actually, you have
Okay,
to-
so who would like to? Yeah. Okay, so
You-
what is your station, doctor?
my station is hypochondriasis.
Hypochondriasis.
Yes. Doctor, can you? It is
Yeah.
written that the host has stopped.
Yeah. I don't. What did I? Yeah. Okay,
Thank you,
so.
doctor.
Okay, so in this station, be ready with the following. Why am I talking to a psychiatrist? Be ready that mind and body is one unit, and many times the physical symptoms can have psychological reasons behind them, particularly if the investigations and the clinical assessments were all okay. Okay, and she will insist also that this patient should also do a PET scan or something like a dye, MRI with a dye, something like this, an unnecessary investigation. So your answer must be that this is not the best way to help Mr. X, because this will emphasize that for him that he is in need for the investigations and will make it difficult for him to correct this false idea that he has brain tumor. Okay, so we don't use investigations to calm down the patient because it will fortify the false idea which he has. Okay, I will ask you what are the reasons behind this. In general, we have the common answer that there is chemical imbalance, past history of psychiatric disorder, family history of psychiatric disorder, serious illness in one of the family members or in the patient. But in addition to this, there is a coming from a family which seeks medical service for minor symptoms and chronic illness in the child. Okay, so in addition to the general causes or factors which increase the chance of having any mental disorder, we add the family issue and the chronic disease in the child. Okay, so let's start. Okay, so let's go. 1, 2, 3, go.
1 second, you didn't say the name.
Yeah, okay. So let's say that I am the wife of Mr. White, and I'm Mrs. White.
Okay.
1, 2, 3, go.
Hi, Mrs. White. I'm Dr. Arif, one of the psychiatrists of the mental health team here. I have assessed Mr. White, and I'm here to have a chat about further discussion about his management plan.
Well, doctor, I don't want to be rude, that I'm wondering, why am I talking to a psychiatrist? I thought that we are going to talk with a neurologist.
I totally understand your concern. Actually, the neurologists have evaluated him, and he has done all the relevant investigations, and he has cleared him of any physical illness that he is fearing of. And as you know, the mind and body is a single unit, and in cases like this where there is long-standing physical problems, we are usually getting referrals to understand if there is any psychological cause that can predispose or worsen these conditions. So we shall work as a team to help you better. Is that okay for you?
Very good. Okay, doctor, so no problem. So well, how can we help him then, doctor?
First of all, I want to know what is your understanding of his condition?
Well, I feel that he has this strong belief that he has brain tumor, and we lost a lot of money on the investigations and on the physical consultations, and we wants now to do a PET scan. I hope that you help us with this. If it is possible for you to order a PET scan for him, this would be great.
I really understand your concern. I'm sorry to hear that. I understand that it is affecting your finances a lot, and I will get back. I'll get back to the question of PET scan soon. And let me ask you a few questions. Has this problem led to such an extent that he has thoughts of harming himself or anything?
No. But it caused a lot of financial problems.
Yeah,
he cannot go to work, and we spend a lot of time on these investigations.
I understand. I have assessed him, and as per my assessment, he is having a condition called hypochondriasis or health anxiety disorder. Have you heard about this term before?
No, what is this health anxiety disorder?
Actually, in some patients, some people, they tend to start develop a belief that a false belief that they are having a major physical illness, which is of a grave nature. And they will misinterpret symptoms of usual minor physical ailments as the cause of this major physical illness. And they will go on to see several doctors, several specialists, do several investigations, like in your case. And they, even after getting all the negative results, they won't be reassured with it. And they would go on to see several doctors again and again. If they are reassured, they will be reassured only for a short period of time. And this is exactly why I was saying that this another investigation related to this and another test related to this will not be helping him. If it all helps, it will reassure him only for a short period of time, and he will feed into his anxiety, and it will result in another anxious thought of having another investigation. So, okay.
Okay, doctor. So what is the reason for this health anxiety disorder?
There are several reasons supposed, can be occurring in patients who are having a past psychiatric history, like who has psychiatric illness in the past, and it can be occurring in patients who have grown up in a family which is very health conscious. That is, each of his physical symptoms are being taken care of, and he is being shown to GP for every minor ailments, and he's taken off school for that. And if he grows up in such a family, these things will feed into his mind in such a way that he will be anxious about every physical illness, every physical symptoms that he has. And when some psychological stresses occurs, they can start develop any major illness in the family occurs. Such as if a major illness in the family occurs, they can develop this disorder. And there are studies that show there are abnormalities in brain chemicals like serotonin in such patients.
Okay, so how can we help them then?
Yeah, before talking about management, let me recap what we have discussed. I have said that he's having a condition called hypochondriasis, which has, even though it is not causing any physical risk to himself, it is resulting in a lot of financial loss to the family. And and we have to take care of his, I have to inquire more about his family support and for the further management of the patient. And the management part comes that I want to see the patient myself, and I want to keep him in outpatient review, regular review, so that I want to follow him up for the development of any other symptoms or his progression of illness. And the main stay of treatment is psychological treatment. That is CBT or talk therapy. Have you heard about this term before?
No. What is the CBT? This is cognitive therapy.
Yeah, actually, here, as I said, that he's having a lot of false beliefs about his illness, and he's misinterpreting usual symptoms of body ailments as symptoms of major illness. And we will try to address and challenge these beliefs and misinterpretations and try to correct it.
1 minute remaining.
A trained therapist will regularly see him and do it in a professional way, and we will try to reduce his illness-seeking behavior, treatment-seeking behavior in the course of his therapy. And we will also try to address his anxiety. This is basically an anxious thought about his illness, so we will try to address his anxiety by counseling and relaxation techniques also. Are you able to follow me?
Yes, doctor. Yeah. Do you think that he might get better?
Yeah, actually, it depends on the initial response of the treatment. If he is not able to be improved by the psychological therapy, we will try to add on other medications for the management of his condition. And we will also include the family for the understanding of the condition by the family is very important for the improvement of his symptoms.
Okay, thank you so much. How do you feel about what you did? Okay, give me your feedback, and I hope that I don't. Nobody wants to give you feedback. Come on, doctors, come on, give him some feedback. He's our colleagues. Nobody. Maybe they cannot catch up with what you are talking so fast. So, how do you feel about what you did?
Actually, I just missed some points. I think I was stuck at the management formulation part itself.
Yeah, so everyone is saying that you're very fast. I did well, but bit fast. Yeah, prognosis, where they paid attention that you do not talk about the prognosis in the best way. PET scan, okay, so overall you did well. You did not mention the seeing the patient again. So well, pay attention to the feedback of your colleagues. It's not far from what I'm going to tell you. So everyone is talking about your way of communicating, doctor, which is the most important thing in the task. Don't talk fast, don't lecture. You must chunk and check. Make sure that what you are saying is going to be understood by the role player. Even if you are saying with the right information, this is not enough to pass. Okay. Everyone it's the way of your communication. Okay. Before the formulation, well, doctors, I want you, whenever you want to formulate, make your formulation relevant to my question. So when I ask you how you are going to help Mr. White, signpost and use a sentence which will make the role player feel that what you are saying is related to his question. So you can say something definitely, but before going through how we can help him, I would like to highlight the most important points in his condition, which we are going to focus on in our management plan. So this sentence will help him or her understand that this formulation is related to the question. But when I say to you, how are you going to help him? And you say that just, I would like to highlight the important points in his condition, and you formulate, this is not very close to my question. Okay, the examiner can think that you have your own agenda. We don't want this. The communication skills can help us to avoid these negative feedbacks. When you signpost in the right way, definitely this will help you to do what you want, and at the same time you are not missing the patient's question. Okay, and after the formulation, chunk and check and make sure that the lady understand what you did. Again, the CBT, when you explain the CBT, try to make the CBT explanation well, you are not lecturing about CBT. Explain the CBT in relation to this man's condition. So this man has a particular idea which is making him very anxious, that he has a brain tumor. And this is what we call the cognitive part, and the anxiety is the feeling, okay? And there is a particular behavior which is not helpful, which is the illness-seeking behavior. He seeks a lot of investigations and medical services. So we have a thought which should be corrected. We have a feeling which should be corrected, and a behavior which should be corrected. And this is what the cognitive behavior therapy is all about. We are going to correct the thought, and we are going to correct the behavior. He will also be taught some relaxation techniques, and also will be given some medications to help to decrease the anxiety. And I will give you leaflets about it. Okay, and definitely everyone can do it even better than me. My English is not better than yours. But when you explain the CBT, make sure that your explanation is not lecturing about the CBT. Try to appear professional to the examiner that you are going to formulate this CBT according to this man's needs. Okay. Again, the prognosis, doctor. This is a very common question. Is he going to get better? I'm not going to go through this again. You know, you have attended with us before this these sessions.
Yes. Actually, as I was not aware of this prognosis, I said I know that these conditions are having poor prognosis, and I am not aware of his good prognostic factors because of his. I don't know his family history, and so
Okay.
I was.
Okay, so let's see our slides here. So we have the introduction. I felt that you introduced yourself in a very good way. You answered the question, why am I talking to a psychiatrist, in a very good way. And then you should gather some information after that. Tell me more about it. Basically, he's free from any medical disorder. Okay, so you have some sort of information which you need to know about his social circumstances, level of risk, and if there are any underlying psychiatric problem, just screening. Why we do this? Because this will help us to set a formulation. Very important to check the risk, doctor, in any stations. Show the examiner that you are a safe practitioner. You explain the diagnosis in a good way, but please chunk and check. Don't rapidly. Then formulation. I want you to formulate now, please. Please, Dr. Arif, formulate. What is the main psychological problem? What is the level of risk? All this in the background. What are the information which you need to know, or you know, in his biopsychosocial area? 1, 2, 3, go.
He's having a condition called hypochondriasis or health anxiety disorder, which is having having no physical risk to him, but he's having impairment in the areas of social and financial areas, and all this is happening in the background. I didn't check, so I cannot ask about
Background that we need to know more about his social circumstances, any underlying psychiatric disorder. Okay, if you don't know, you can see that we need to know. And there is no underlying medical problem. There is no past history of psychiatric disorder. Okay, how we know? Good that he said we didn't know. How we know? Because we started the station by asking the lady some questions about her biopsychosocial needs. Okay.
Yes.
And then after doing your formulation, you should start your management plan. Talk with the patient, please. Did you say that I am going to talk with Mr. X and explain? Okay, very good. Where he's going to be treated, he's going to be treated at home.
Yes,
and he will follow up in your clinic by a team. The investigations are done, but you can do for him particular investigations to make sure that the medications which you are going to give him will be safe for him. Then you have the multidisciplinary team, which will involve the GP. The GP also must understand his condition to make sure that this man is not going to misuse the medical services. Very important to say this. I'm going to explain his condition to the GP to make sure that there will not be any misuse of. You will not find this information anywhere, by the medical service, because this man is abusing the medical service, as the wife is saying. And then your psychological support will be the medications and the CBT. And then the non-pharmacological, you have the social services. You must make sure that his treatment duration is not going to affect his functioning, and also maybe some support from the occupational therapist if there is a place for his or her support. Okay. Thank you so much. Let's see the mark sheet. Again, I'm not here. I'm not an examiner. I'm just showing you the mark sheet, which will help you. Okay, so formulation, you did formulate. You identify the significance of finding the result. The management plan. Well, did you talk about the GP? You did not. You talked only about the GP, the CBT, and the SSRIs. Okay, you will talk with the patient yourself. Adequate risk management plan. So there is no risk here, but still show to the examiner that you are a safe practitioner, that you ask about the risks, that when you talk with your patient, you are going to do risk assessment. So even though in this station there is no risk, but still you must show to the examiner that you are a safe practitioner and you will talk about the risk. This point might or might not be scored for you. Did not talk about any social intervention. It was organized, but it was very formal, actually, very formal, as if you were lecturing. You were talking so fast. Listening skill was not good. You're not keen to incorporate me. So though I feel that you have scored a lot in the management plan, but the communication skills, I cannot say will help you at all, doctor. So please talk in a slower pace and pay attention to the feedback which you have got from your colleagues. Thank you so much. Thank you, doctor.
Thanks. Thank you.
Okay, who would like to go next?
I would like to go next, Dr. Hassan. Rizwan.
Okay, just give me 1 minute. I like to read the feedback of our colleagues in the chat section. It's very helpful. I hope that all of you have a look at it. Okay. Okay, so thank you so much. Okay, so who would like to go next? I think
Uh,
Dr. Rizwan. Dr. Rizwan, isn't it?
yes, doctor. Yes.
Okay, so please, doctors, if anyone has an open mic, please try to. Okay, please start your video, doctor.
Okay.
Okay, so how do you feel, doctor? What is your station?
To explain the patient about lithium use in pregnancy, Sarah patient.
Just give me 1 minute. Just I want to refresh my memory about this station. Sorry, just give me 1 minute. This part 3, I think. Yeah. Yes. So pay attention to the following. Most of the candidates just focus on the lithium, and they forgot that this lady is taking 60 milligram of fluoxetine. Though fluoxetine is safe in pregnancy, however, it can affect what? What can it affect, doctor, if it is taking in big doses during the pregnancy? Yeah.
It can cause a relapse of mania. And
What?
other than that,
Because what?
Can cause a relapse of mania.
No, doctor. It's safe in I mean for the baby. So it can affect the development of surfactant. The surfactant can be affected.
Oh,
So
okay.
it's safe in pregnancy, however, but the babies or the mothers who are taking this big dose, the surfactant can be affected. Okay, so definitely this lady needs her. She and her baby must be admitted in the mother and baby unit. Okay.
Okay. So this is station that I got. There's not mentioning of
It is
frogs.
stage. No, your station is lithium in pregnancy, station 8 part 3 in our notes, isn't it? Yes.
Okay.
Station part 3 in the notes. It's I'm seeing. I'm looking at it right now. You are talking to the husband, Ronald Smith.
No, this one. Lithium usage during pregnancy. Patient is Sarah.
Yes, doctor, but I have sent a particular station which usually comes. It is patient. The station which I'm talking about, it is about a lady who is taking lithium and taking fluoxetine, and you're talking to the husband. So most of the candidates forget the effect of the fluoxetine. And they think that when they talk about the effect of lithium, they have covered everything related to her medications.
Okay.
Okay, what about having a look at this station until we can have another candidate?
Yeah. Okay. Yeah, that's fine.
Okay, I will send it. Do you know how to pick it up from the notes?
Yeah, like you send that book get through cask. I'm
No,
looking at.
this is not in the get through book. It is from the notes.
Okay. Okay. Actually,
Okay, I will screenshot this station and I will send it on the group.
I don't have that minutes.
You will find it on the Telegram group, on the WhatsApp group. Okay.
Okay. Okay.
Okay, so until Dr. Rizwan prepare the station, who would like to go next? Yeah, Dr. Ahmed, very clever. Pulmonary hypertension, very clever doctor. That's because it's free to use. Okay, so we have here some discussion about the text, which I don't have any idea about. So who would like to go next until Dr. Rizwan prepares his station?
Mania management. Hello.
Dr. Nasser, okay, how are you?
Yeah, fine.
Assalamu alaikum.
How are you?
How are you?
Alaikum
I'm fine.
assalam.
Okay,
Mania
give me-
management station.
Okay, this is you are talking with the son of the old man. What can
Yeah.
you just rapidly refresh my memory? What is the story?
A story, you talk to the patient, 28 years old, who diagnosed with a mania 2 years ago, elated grandiose delusion, and he started in lithium for recovery and stop lithium. And after that, recently developed a very happy, decreased sleep, more energy, going to gym, talking about project, producing a film actor. The task is speak to him about likely the diagnosis and formulate management plan.
Yeah. So yeah, I know this station. So I did everything right in this station, but I did not pass because according to what our practice here, the symptoms which the patient has, these symptoms are enough for us for him to be admitted. However, for them, no, as long as there is no high risk, it's only financial risk, and he's willing to take the medications, no place for admission, compulsory admission. So pay attention to this. Number two, this patient, he will say to you, no, I don't have bipolar disorder, I have mania. I've been treated before for mania. Why do you say that I'm having bipolar disorder? Okay, so you must explain to him that having a single episode of mania is not sufficient to diagnose a bipolar mood disorder. However, having 2 episodes is sufficient for us to consider the diagnosis of a bipolar mood disorder. Are you with me, doctor? Don't forget to discuss about the risk, and don't forget to talk with him about why he stopped taking lithium. This man stopped taking lithium for a reason. He started to have shakiness, and unfortunately, he also felt that he is not good with the girlfriends and so on. So he wants a medication which doesn't have this type of side effect.
Yeah.
Okay. If you said to him that you must be admitted, immediately you will lose the patient, and they instruct him to be very defensive. Okay. 1, 2, 3, go.
Hello, Mr. Bethany. I'm Dr.
Go. I go on to.
Hello, Mr. Bethany. I am Dr. Gabriel, one of the psychiatrists working here.
Hello, doctor.
I understand that you have been recently came by your family. Could you tell me what is going on?
Well, doctor, they don't understand, doctor. I want to start my own project. I want to do a documentary about nature. and they feel that I'm doing something weird, but this is my passion. This is something which I definitely am going to excel in, because this is something which I feel is going to come natural for me. I took a bank loan and I decided to go to Africa. I bought some expensive cameras. That's why we are a bit, bit worried about what's going about me. But doctor, it's very hot here. Can you bring me a cup of water, please? Or Coca-Cola, something which can make me feel better, doctor. Any problem? Just to can we discuss this in the Starbucks, doctor, if you don't mind,
Yeah,
please?
I can see, Mr. Bethany, you have a lot of ideas coming in your mind. Could you tell me since how long you feeling like that?
Well, doctor, it started, well, these are not thoughts. I feel now my mind is better. After stopping the medication about 3 weeks ago. I feel now that I'm thinking about many things, I can, excel in many things and understand better. As if this medication was restraining my mind.
Sorry to hear that, Mr. Bethany. Could you tell me more about your sleep?
Well, I can only sleep 3 to 4 hours, though I used to sleep 7 hours, but who cares? Now I sleep only 3 to 4 hours.
Are you able to look after yourself, Mr. Bethany?
Yeah, doctor, no problem.
And understand that you have spent much of money. Could you tell me more about that?
Well, the problem is that if there is a project, definitely I need to put some money in the beginning, but there is no problem as long as this project is going to bring this money back. As I said, I'm going to do a documentary about the nature, and I can sell this documentary to the National Geographic or the BBC. Many ways by which I can bring this money back. But my father and mother don't understand this.
Your father didn't understand. If someone didn't agree with your project, how do you react?
Well, I just don't. I'm not a troublemaker. I have my own life, and everyone has his own life. Who cares?
So, Mr. Bethany, I have an understanding that you have been previously admitted in the hospital. Could you tell me more about that?
Yeah, they said that I have something called mania, but I think this is not the case anymore. I took the medications now for not less than 1 year, and I decided to stop this medication because I felt that I'm not happy with this medication.
Could you tell me more why you are not happy with this medication?
Because I had some sort of tremors in my hand, and also, this medication caused something for. I was not good with my girlfriend, and she left me. But I feel because of this problem.
Mr. Bethany, have you tried to enjoy something by using any street drugs?
No.
Yeah. So, Mr. Bethany, I understand that you have been a lot of ideas coming in your mind, and you have a little amount of your sleep, and you have a project in your mind. And since 3 weeks this is going on, so I can see that you are suffering a manic episode like happened in the past. What do you think?
Well, I don't think that I have any problem, doctor. Maybe this is your evaluation, and I respect it, but it's my life, and I have a project which I should work on, and I'm not hurting anyone, doctor. So why there is no problem?
Yeah, I can see your point of view, Mr. Bethany, but I can see that you have suffered from previous manic episode in the past, and you are recently also suffer from similar episode. So I can see that you are suffering from what is called the bipolar affective disorder.
No, they said that I have mania. I don't have bipolar. Nobody said that I have a bipolar mood disorder, bipolar affective.
You are right. You are right, mania, when some people feel high energy, lots of idea, decreased amount of sleep. But when this become recurrent, we call this like as a bipolar affective disorder.
So doctor, what can be the problem now if I have, you can say whatever, I'm not causing problem for anyone else, doctor.
I can see your point of view, but would you like to discuss with you how we can help you through this difficult
Help me
time?
through what? I don't have any problem, doctor. Why do you insist to interfere in my life? I don't have any problem.
I can see your point of view, but you have a similar episode in the past, and you recently now spend much of your money, and you have a little amount of little sleep. You decrease the need of sleep, and we need to offer you help through this difficult time. What do you
Well,
think?
I'm feeling well. If any problem with that I'm feeling well, that I'm going through a new era in my life. So I don't know, doctor. So anyway, so well,
Yeah.
what type of help you want to offer me?
If you would like to, if you would like to be admitted,
Inshallah, when you're
if you would like to
1 minute
be
remaining.
admitted in, if you would like to be in the hospital and to offer you some
No,
investigation blood.
I don't want to be admitted. I want to leave the clinic now. No, I don't want to be admitted anymore. Why should I be admitted? I don't do any problem. I was admitted before because I did some wrong things, and I was risky for myself. I did a car accident, and I attacked the police. So yeah, I should have been admitted because there was a problem. But now I don't have any problems now. Why are you talking about the admission?
I respect your point of view, so we can offer you some medication and refer you go to stay at home and involve the medical team, come to see you on a regular basis and offer you medication. What do you think?
What type of medications?
We can offer, I can see that lithium, you have suffered from some shaky from lithium, so we can offer another antipsychotic medication, can stabilize your mood, like called olanzapine.
Well, does it cause any side effect?
Yeah, it and like any medication has its own side effect, but it will be stable.
خلاص يا معلم. How do you feel about what you did?
Time management.
Yes, time management. And again, I said that don't offer the hospitalization as the first option, but you can say to him something like that. We don't want to go through a readmission again, because if this mood problem is not controlled, it can escalate and you can pose risk to yourself and the others. And unfortunately, the admission can be considered. We don't want to go to this level or this situation. Are you okay with me? But don't talk about, because this is the typical mistake which I do. The typical, once you talk about the admission, he was immediately defensive. Don't talk about the admission. You start by discussing with him the medications and following up in the OPD and by perinatal team, and giving him an idea that this problem, if it is not managed properly, and he should take, that's why he should take the medication. Because if this is not happening, unfortunately, he might be admitted. Okay.
Okay. Okay.
Okay. So let's see. Courtney, you have very big fan here. Someone, your friend, man. Asad is your friend. Okay. So, yeah. But he's very experienced, Dr. Asad, actually. Best wishes for him. Very, very clever doctor. So let's see. Actually, he did everything good. But pay attention in the beginning when you, let's see, according to the slides. In the beginning, what we should do is that we start by gathering the relevant information. If he has any underlying medical problems, and check more about the mood, if there is any associated auditory or visual hallucinations, any stressors, any risk. And I think you should have covered the risk more in this station. Why is that? Please don't go through the station with the idea that you know the scenario of this station, that this man has only financial problems. We can put some changes in the scenario and the risk can be very high accordingly. You can put some, you can just tell me any concerns about your safety. So you mentioned that you are spending too much money. I'm worried about you. So do you drive the car fast? Have been any problems with the police? Any interaction or physical conflict with anyone? Okay, just go deeper in this station in relation to the risk, because it is a mania. Okay. You explained the diagnosis in a very good way, but can you just please formulate for me, doctor, please?
Suffering from two episodes of two manic episodes. Recently, high mood, decreased sleep, much spend of money. Diagnosis bipolar affective disorder, biopsychosocial. We need antipsychotic medication like
No, this
olanzapine.
is management.
And
Doctor.
when
This is the management. Doctor, this is the management we need when you say, what is the background? What do you know about his background, biologically, psychologically, and socially?
biologically, he suffered from side effect of lithium, so stopped. We need to offer another medication. Social and psychological, I didn't ask. Risk factor.
Okay, so again, you feel that it is difficult for you to formulate because unfortunately you should have asked him some questions in the beginning, which will give you an idea about his physical condition and psychological and social condition and level of risk, because this information will help you to formulate properly. So you should have asked him these questions to come up with enough information to formulate. So having said this, we can say that this Mr. White is having a bipolar mood disorder because this is the second attack of mania or hypomania, according to, can be considered as hypomania actually. And there is financial risk. All this in the background that he has some physical side effects from his medications, past history of being admitted because of one manic episode, and there is a good social support. Okay, you can phrase it by many ways, but make sure that you formulate and cover all the information which you know about the patient. Okay, now then what we are going to do. Okay, so after the formulation, what are you going to do? You are talking with the patient yourself, and where he's going to be treated. This was the mistake. He should be treated at home, and you are going to follow him up closely and by a team. And there is a big chance that if he does not take the medications, the risk can be high, and for his safety, he might be in need for admission. You must do investigations as long as you are going to give the medication. Did you talk about the heart tracing? And did you talk? I didn't hear from you the investigation.
I talked during discussing his admission to offer you blood investigation and offer medication when you will be admitted in the
No, when you talk, please, when you talk about the investigations, state clearly what type of blood tests that you need. Okay. Heart tracing, liver functions, kidney functions, blood chemistry, and so on. And here you have the crisis team or the multidisciplinary team. All of them can be correct. Okay, and psychologically, you have the medications we are going to give him. And if it is not lithium, as you said, it can be olanzapine, and there will be a nurse who will follow him at home. Okay, very good. Thank you so much. Mania.
Thank you.
Very fast. Yeah, Dr. Asad is, and all of them are talking about the risk which you should have assessed. So let's see the slides. Have a look at the feedback of our colleagues. Very effective, very good. Okay, so you did not formulate, by the way, so this point is not going to be scored for you. You paid attention to the significance of findings and results, everything very good. Your management plan, unfortunately, this is not good because the first thing you said that this man is going to be admitted.
Israel, please reduce the volume.
Okay. And then you have the sufficient attention to the patients. Have you, again, because you did not pay attention, you were very authoritative. Even if you felt, even when you offer this admission, you can say, how do you feel about staying in the hospital? Because this can be safe for you during this. Don't talk like this in the exam, that you need to be admitted and so on. Tell him, how do you feel about being admitted? Because this is safer for you, because so on. So unfortunately, this point might not be scored for you. The risk management plan, again, this can be good for you. Everything is psychologically and social. You talked about the team, so this can be scored for you. Everything in the communication is good, except unfortunately there are 2 points which are considered to be biased towards those who are native English speakers, or those who are good in English language. And that's why the candidates feel that the exam is biased towards the native. Actually, no, I don't think so. It's because most of the IMGs, a lot of them actually, not most, lose these 2 points, which are related to the language. So how come anyone who feels that his language is average, please write down the sentences which you are going to say in any stations, and then practice them between yourself and with your colleagues. In the beginning, you will find that you are writing too much, but later on, you will find yourself that you don't need to write that much because the sentences are repeated in every station. So please pay attention to this, Dr. Moss. Okay, thank you so much.
Okay, thank you, Dr.
Thank you,
Sam.
Doctor. Who would like to go next? Okay, who would like to go next?
Can I go? Can I start?
The doctor is one.
Yes. Yeah.
Are you ready now?
Yeah.
Okay, how do you feel about the station? You find it difficult?
Yeah, it's a bit tricky.
Yeah, and it usually comes, unfortunately, more and more. And pay attention to the mistake which most of the candidates do. They don't pay attention. And this lady is taking, yes, fluoxetine is safe to some extent. There is no 100% safety, particularly if the dose is high. This lady is taking 60 milligrams. Okay, so I'm going to talk with her husband, and I will try to ask you the questions related to the station. 1, 2, 3, go.
Hello, my name is Dr. Isman, and I'm one of the psychiatrists working in this hospital. I understand that. Hello, I understand that you have some concerns. Can you share me about your concerns?
Yeah, doctor. My wife is she's taking 2 medications, and I want to have baby, and also she wants to have babies, and I want to know exactly what are our chances and what are the effects of these medications on the baby.
Okay, I understand that. Uh, can I ask what medications she's taking and what are your particular concerns regarding that medications?
Well, she's taking together. She's taking lithium,
Okay,
and she's taking also fluoxetine.
fluoxetine. Okay,
Yeah.
and how? Okay, and how long she's been taking these medications?
Well, she's taking these medications now for 5 years, and she has been stable for 5 years, and want to have a baby.
Okay, and can I ask about why was she prescribed these medications?
Yeah, because she had previous attacks of depression, and these attacks were so severe she needed to be admitted.
Okay, all right. And how has she been doing recently?
Well, she's so fine on these medications. We want to start our family and to have babies.
Okay, all right. And does she has any thoughts of self-harm at the moment or any?
No.
Okay, and all right. So yeah, that's right. Yeah. So this medication called lithium, it has it is not recommended during pregnancy as it imposes a risk to the child, to the fetus. So usually we do not recommend lithium during pregnancy.
And what is the
Because
effect? What is the effect of lithium on the pregnancy?
yeah, as all right. So I'm going to tell you about the side effect, the effects of the lithium on baby. So basically, it can cause heart defects in the baby. So there is a 1 in 10 chance of having malformations with lithium, and The study says that there is 10 to 20 times increased risk of abstinence anomaly, which is a kind of a specific heart defect. So it's very like dangerous to the baby in terms of, because it's a serious effect. Do you understand that?
Well, I think now we can stop all these medications if they are very serious like this, doctor. How do you feel about that?
Actually, yeah, basically, we cannot stop it directly as it carries a risk of a relapse in your wife. It can cause a relapse of a condition because she has a significant past history, as you told that she was admitted. So what we're gonna do, we are going to reduce it gradually, and then we stopped it, the lithium, uh and then like you can plan, the pregnancy with that. And just to let you know about the other medication your wife is taking, fluoxetine. It is relatively safe in pregnancy, but there are some side effects with fluoxetine as well during pregnancy. As you know that all the medications has some side effects. So yeah, do you understand that?
I see, doctor. So how can we help my wife then?
So what we gonna do, like uh I'm going to keep her on. I'm going to talk with your wife as well, and we'll discuss the options. And I will, as I told you, I'm going to keep her on fluoxetine, and we will closely monitor her. We'll offer him a quick rapid follow-up appointments so that we can monitor her mental state, how she is doing. And we can also we have a team which consists of like psychologists. Will offer her a psychological support in terms of her mood, and we'll keep a close eye on her.
Okay.
Is that, yeah? Do you have any other concerns other than that?
No, thank you, doctor.
Okay, and another thing that I would like to tell you that I'll discuss with her about the signs of relapse, as it carries a risk. In case she is really she developed a depression again, if she relapsed, she can there is a risk to the baby as well. And I'm going to liaise with the perinatal psychiatrist as well. I'll write to him to inform about the situations, and then we're going to do tests, scans to make sure the baby is doing well.
Okay.
Is that right?
Okay.
Yeah. And yeah, thank you so much for talking to me. And if you have anything else to or any other questions,
1 minute remaining.
if
Finish.
okay, just to recap everything what we have done so far. So as you are planning for pregnancy, so your wife has a condition called resistant depression, uh and she is quite stable for the past 5 years on some medications, lithium and fluoxetine.
Excellent.
uh and if as it carries a significant risk to the baby, so we have to gradually stop this medication. And we will keep a close eye on her to make sure everything is okay during pregnancy.
Okay. Thank you so
And
much.
yeah,
Fine.
just to, okay.
How do you feel about what you do?
Yeah, I think I've lost the plot because
We were doing, you are doing fine, by the way. You're doing fine. Okay,
yeah.
so again, doctors, the doctors will give you a very good feedback. Again, pay attention to what they are going to say. But up to one, no one wants to give you a feedback. I don't know what. So when I asked you what about stopping the medications, I expected from you to talk about the high risk of relapse if she stops the medications, and this can cause a risk on her and the baby. bearing in mind the past history of the patient. Okay, so it is not recommended to stop the medications. Bearing in mind the pros and cons of stopping the medications, the pros much weigh the cons. Okay. Mother, okay, so well, I hope that, well, you know, when you talked about the manager, I felt that you're not very clear. So basically, you're going to talk with her, you're going to stop the lithium gradually under your observation. And when the lithium stops, she can get pregnant, and then she can have either a continuation without lithium according to a preference, or she can take lithium. Okay, and every decision carries its own pros and cons, which she is going to discuss with you. And if her husband also wants to be in the discussion, he is more than welcome. Okay, so this is how you talk about the lithium. I didn't feel that it was very clear. Did you say that what I said? That go ahead.
No, I think I didn't offer this thing that it's her choice that she can be continued on lithium.
She has, well, but basically you said that she's going to stop lithium gradually, then she's going to get pregnant. So the pregnancy is going to be planned.
Yeah.
According to the lithium level. Once the lithium level is not in the blood enough dose to affect the baby, she can get pregnant, and then the reinstation of lithium will be either after the first trimester or going without lithium according to her preference. Because if she's going to take lithium, it can affect to some extent the baby. There is no 100% guarantee that she's not going to be, the baby is not going to be affected, and also she cannot nurse her child. Okay. Did you talk about the mother and baby unit?
No.
Okay, so
I just said that I'm going to liaise with perinatal psychiatrist. That's it. I didn't say that.
perinatal psychiatrist.
No, perinatal mental. Yeah.
Okay, no. So the story goes that this lady, Dr. is not pregnant yet. They want to know what are the chances. Okay, it is very important to understand the setting. You are talking to her husband and she is not pregnant yet, but she is taking lithium and taking fluoxetine. Okay, so there is no place to ask her how long is her pregnancy. She's not pregnant yet.
Like in the future, like when she
Yeah.
in the management.
Okay, so again. Okay, doctor. So you gave the relevant information in a very good way, and you explained to him the possible risk. And I hope that you mentioned that the risk can be up to 80%, and this can be risky on the baby and on her if she is not taking her medications. Please formulate, if you can formulate, please. Again, formulate.
So as I said, like so your wife has a condition called resistant depression, and she is on 2 medication, lithium and fluoxetine, and you guys are planning to get pregnant, and it carries a risk if we continue lithium. If you continue lithium, it carries a significant risk to the baby and to the mother in terms of relapse. And on the background of her, like psychological issues, and on the background of hormonal changes.
Or what hormonal changes? All the background. She doesn't have any underlying medical problems. There is a past history of being admitted to the hospital because of depression. And that's why there is high risk, and there is good social support. Make it smooth, make it simple. This is not, it doesn't need to be 100% an accurate academic formulation. All what we need to know is to score the point of formulation in the mark sheet. Okay, it needs some practice, but with time you'll master it. Okay, so you gather the information. And and again, doctor, while you are talking, you must mention that there is high risk. There is risk on the baby and there is risk on the mother because of the whole circumstances. The pregnancy itself carries high risk of relapse. Okay, then you must talk with the lady as the first thing. Well, you mentioned that you are going to talk with the lady, but very late. So you must talk with her, discuss everything with her, and see how she's going to take her decision, and then you are going to help her. Where the patient is going to be treated at home, and she's going to be followed by the perinatal team. The investigations needed are very important to make sure that the lithium level is okay and it is going according to the plan. And then the multidisciplinary team is the perinatal team. You're going to liaise with the obstetrician. Everything is going to be planned from now on. The delivery and the period after the delivery in the mother baby unit, and even when she goes back home because of the high risk of relapse. Okay. So the psychological treatment here. So some of the candidates are asking, this lady has the option of either continuing without lithium or taking lithium after the first trimester. It is her decision, and you will help her in both of these two decisions. Okay, so, but anyway, and even if she wants to go through the whole pregnancy with lithium, it's also her decision. If you want to be more accurate, you're going to discuss this with her. Maybe she doesn't want to stop lithium because she was suicidal before. So I'm going to keep lithium in the lowest level. So if you want to add another realistic option, that if she wants to continue with lithium, you will try to keep the lithium in the lowest possible clinical dose to make sure that her baby is not going to be affected, and the baby is going to be followed up by the obstetrician. And she has the other option, either to stop lithium gradually and get pregnant and start lithium after the first trimester, or to stop lithium gradually and do not take lithium all the way through the pregnancy. Okay, and you are going to discuss this with her. Okay.
Yes.
You know now why the candidates do not pass this type of stations, which includes discussion with the patient and seeing what their decision is. It's not, we are not accustomed for this approach as clinician in our countries. We are very authoritative. We are not here to say who's right and wrong, but I'm just telling you what the problem with this type of stations. Okay.
Right. Thank you.
Okay, thank you so much. Let's see the mark sheet.
Thank you.
Okay, so you formulated, I think, did you formulate? Formulated, did you?
I don't know.
Well, I don't know. You know, it is very difficult to do with the role player and take notes. But anyway, you formulated, okay. You say identified the significance of findings and results. Your management plan, actually, I don't know, man. If you can do it better. So most probably this point is not going to be scored for you. And then you said that I'm going to talk with the patient, though it was not very organized to say after this I'm going to talk with her. But anyway, you said it. So this point is going to be scored for you. The risk, you said that, did you talk about the mother and baby unit?
No, I just explained that it carries a significant risk to the baby. I just and to the
You
risk
did
of
not talk
relapse.
about the mother and baby unit. You did not talk about the high risk of relapse because of the pregnancy on the patients who have mood problems. So most probably this point is not going to be scored for you. Psychological and social interventions. Did you talk about the nurses going to follow her up as part of the perinatal team service when she goes back home?
No.
So this point is not also going to be scored for you. It was not very organized. Everything else, it was good. Okay, so I'm not here to say who pass or fail. I'm just giving you an idea about the mark sheet. Thank you so much.
All right. Thank you.
Thank you, doctor. Don't get frustrated. Okay,
No.
you're very good. Okay, so who would like to go next? Okay, who would like to go next? Have we finished? Okay, thank you so much, doctors. Please, it doesn't end here. Take all what we have done with your study partners. Very important. Maybe what we have done now is not more than 50%. You should apply it with your study partners. And the exam is not that far. Pay attention. Okay. Good luck. I hope to see all your names in the post list. Thank you so much.